Good afternoon. Good afternoon. There are some seats still here in the front if anybody would like to sit. You're welcome to sit. We've got about 10 or 15 minutes of remarks here, and then we'll be answering questions from the media or the community. It's really great to see so many people with us here today. It has taken an army to develop the Children's Service Array, and we felt like it was an appropriate time to celebrate with everybody. Before we get started, I wondered if those who are elected officials, we have a number of them in the room today, if you wouldn't mind just please standing so we can recognize you and your leadership in our community. So thank you everyone for joining us today as we recognize and celebrate together the next phase in development of a comprehensive children's mental health system. We are so pleased to share this important milestone with so many partners who've worked together to implement the requirements of House File 690. We'll hear from several speakers today and welcome your questions at the conclusion of the remarks. First, I'd like to introduce the chair of the Polk County Mental Health and Disability Services Region, Polk County Supervisor Angela Connolly.
Thank you, Liz. I'm grateful for the chance to speak here today and help launch the Children's Crisis Services in Polk County. That sounds pretty good. Alongside Polk County Health Services. Polk County has consistently been supportive of children's services by providing access to crucial mental health supports, including outpatient therapy and mobile crisis services for children. However, there's a need in more extensive services that bridge the gap and support families and their children who are experiencing mental health crisis. The targeted programs of community-based services, residential crisis services, and longer-term intensive family therapy, paired with some upstream supports of early identification and early intervention, address the diverse needs of families in our community. The skilled mental health professionals provide a whole family approach that help kids heal from a mental health condition and give families the skills they need to support their loved one. These programs and services are possible because of our commitment to many of you in this room, all collaborative partnerships. Polk County Mental Health and Disability Service Region funding, paired with financial support from Broadlawns Medical Center and the Polk County Board of Supervisors, allows for the funding of these and other critical mental health and disability services. I want to thank the Broadlawns Board of Trustees, their staff, and the members of the Polk County Board of Supervisors for their financial commitment that will improve mental health outcomes for all of us that we serve. The development of the children's system in Polk County has been the work of so many, and a lot of you are in this room, so I don't want to start by mentioning all of you because I'll probably miss somebody, but including the Polk County Children's Behavioral Health Collaborative, the Polk County Region's Children Advisory Committee, who've worked tirelessly to get this done. Members of these groups also include educators, social workers, counselors, family members, advocates, juvenile court officials, mayors, and child care providers, law enforcement, pediatricians, psychiatrists, and many other community members that are here. With us today is Dr. Ken McCann, Chair of the Polk County's Region Advisory Committee. I'd like him to speak now.
Well, thank you, Supervisor Connolly. As a pediatrician, I have a clear understanding of the need for improved children's crisis services throughout our state. The Iowa Youth Survey in 2018, before the pandemic, showed 1 in 10 students reported they had a plan to end their lives. The survey also reported the students' persistent feelings of sadness or hopelessness increased more than twofold from 2014 to 2018. From 15 to 32%. And we're just beginning to understand the mental health impact of COVID among our young ones. Reports from Unity Point in Des Moines show a 40% increase in attempted suicide among our youth. The Children's Advisory Committee for the Polk County region is proud to be a partner in our collective work as a community to bring forward the long-awaited crisis services for children, community-based crisis stabilization, residential crisis stabilization, and intensive family services, and recognize the agency directors who've courageously stepped forward to invest in the development of these services on behalf of our community. Easter Seals, Iowa, and Broadlawns Medical Center have contracted with the Polk County region to provide children's crisis stabilization services. Community-based and residential-based crisis services are effective alternatives to inpatient care for adolescents and children and are part of an integrated regional system of care. The family-centered approach provides interventions that stabilize an acute mental health condition, equip parents to support their children's recovery, and help the family plan for future mental health services. The community-based crisis services are targeted to be performed in the child's home. Families in need of higher levels of support will be served in a residential-based crisis service center where staff are on site 24/7. The crisis stabilization services can be an early intervention to avoid hospitalization, but can also help support a child and their family during the critical transition period after hospitalization and for a mental health crisis episode. Lutheran Services of Iowa has contracted with the region to provide intensive family services for children aged 0 to 5 years and their families. These longer-term home-based services empower parents and guardians to improve family coping skills and help children address their mental health conditions, developing the social, emotional, and cognitive skills they need to succeed in life. By identifying mental health concerns earlier and connecting people with the right services at the right time, we're building a stronger foundation for the future of Polk County. Data alone cannot express the value of reliable mental health services for children and access to experts who help parents navigate healing and recovery from brain health crisis. Easter Seals has been providing support for children and families in our community for decades. Sherry Nelson.
Thank you, Dr. McKinn. Good afternoon. I'm Sherry Nielsen. I'm the president and CEO of Easter Seals, Iowa. I've had the privilege of working with Easter Seals for 27 years, and every day I'm honored and inspired to work with families and children as they overcome the barriers that they face with their health. Easter Seals has provided services to adults and children and support for over 90 years. We're eager for the chance to provide community-based crisis stabilization and residential crisis stabilizations to families of Polk County. These are voluntary services that provide an environment that's less invasive and restrictive than an inpatient hospital. Individuals the age of 18 and under may receive psychiatric services, medication, counseling, and most importantly, links to ongoing services. At Easter Seals, we have seen firsthand that having the right services at the right time is the difference between surviving and thriving. We know that children and family get the supports that they need, are able to live with hope and independence. We want to make sure that no family or child is left scared or unsupported as they manage a brain health crisis. Easter Seals looks forward to continuing the outstanding relationship that we have with Polk County Health Services, the Polk County Health Region, and the other providers of Polk County to ensure that services that children need at critical time are available, including Nancy Krause with Lutheran Social Services of Iowa.
Thank you, Sherry. I'm Nancy Krause with Lutheran Services in Iowa, and I'm the Early Childhood Director there. I've spent about the last 24 years working at LSI, with 17 of those dedicated to these intensive prevention family services. I've worked in many human service programs, but I believe these intensive services are important for nurturing families, leading to positive child outcomes and better communities. Lutheran Services in Iowa is excited to partner with Polk County alongside Polk County Health Services in providing children's services to the community and their families. Lutheran Services in Iowa has been a pioneer with the children's support system in Iowa for decades. And we are looking forward to being a pioneer once again when it comes to supporting the mental health region's expansion of children's brain health services. Intensive family services is a key to being able to provide the right tools for families striving to construct healthy brain architecture in their children's development. Home visits provided by LSI's program has a strong focus on parent-child interaction, which becomes the foundation for the child's development and the child's success later in life. The curriculum we use focuses on physical, social, and emotional development for the child. A longitudinal study of Healthy Families America shows parents had increased sensitivity and responsiveness to their children's needs, and children demonstrate increased positive learning behaviors. This creates close, positive, nurturing family relationships that allows the young child to thrive in their physical, social, and emotional development. Lutheran Services in Iowa has been serving children since 1864. We are grateful to continue to serve Polk County families, equipping them with the skills they need to support positive mental health for their children. We look forward to continued work together with other children providers, including Steve Johnson from Broadlawns Medical Center.
Thank you, Nancy. On behalf of Broadlawns Medical Center, I'm the Behavioral Health Administrator, and we feel very honored to be a part of this historic day, as Angela put it. I think being able to offer crisis stabilization services for children and families in the communities and outside of our office walls is a historic day. So we've, as many of you know, we've provided mobile crisis services for the last several years now to adults and children, families throughout Polk County in collaboration with our partners at Des Moines Police Department, Polk County Sheriffs, and other first responders in the area. We're very committed to seeing this as a new day and making sure that children and families feel comfortable in reaching out for help in a number of different ways. Because we know we've been across the table from parents, from kids, that sometimes that first call, that first reach out is one of the most difficult ones. And we know there's many that don't reach out because of some of those perceived barriers. So we think that's very exciting to be part of this day and in the company of such agencies with experience in this area. So I feel humbled to be part of this, and I did get in this field in 1987, which is usually about older than half the audience was born. So, but I'm getting used to that, and I can roll with that. But I think it is very exciting to have to be part of this. I've been around long enough to know that this is a big deal, and so this is a big deal to be able to say that we can offer something new and alternative, and give a lot of shout out to a lot of our community members who have really pushed for this. Of the calls we do on mobile crisis now, we average 5 calls per day. The majority of those are resolved in the community and result in 0 arrests. So in the past year, according to all our data. So we work closely with the police collaborative to make sure that we can, once a safe site is assessed on site, that we're able to provide our interventions and get our folks where they need to go, and working out safety plans in the community in the majority of cases. And so we're also committed to working with all of our partners in the community to find other alternatives to resolve those mental health crises that don't need to include the police and other first responders. We also provide outpatient therapy and medication management assessment services at our wonderful Medical Plaza building that's been open now for 4 years on the eastern edge of the Broadlawns campus. It's a beautiful facility. And so our idea with the crisis stabilization in the community is that we would connect the therapy, the medication management, that clinical team would now have a new piece of that team to be able to say, yes, this is what I'm working on, this is what the psychiatrist is working on, this is what the therapist is working on. Now we have a new person, a crisis stabilization worker, that can also carry on that work in the community on the same treatment plan. So it doesn't really, I mean, if you're in the field like that, you can sort of give lip service to that, but that's a pretty big deal. To me, that's a pretty big deal within the same agency. You don't need any special releases of information. We can look it up in the record. Yep, this is what we are working on with Johnny Doe. We talked to a psychiatrist last week, and this is what we are working on. So to me, that's a big deal. So we want to do our best we serve about 1,200 kids and families annually for mental health purposes at Medical Plaza, and we want to be able to enhance that service for those families. And speaking of model, so as we wrote to this, we really wanted to identify with the recovery model outlined by SAMHSA that really looks at problems and conflicts that the children and families are seeing day to day. Those same problems and conflicts we can work towards growth and resilience to try to really respond to those. We've got the medical model, we can certainly do medications, we can certainly do therapy, but how can we build up growth and resilience and move beyond some of those conflicts that we know families experience every day, and then how can we help them resolve them and feel stronger as they face that next day. Thank you.
Thanks, Steve. Well, as you can see, we have, with Nancy, Sherry, and Steve, we have the right team in place. There's no doubt in my mind that this work means a lot to so many families. And now more than ever, these services are going to be so crucial to our community. And I take comfort when I know when a parent calls, and they do call our office, I'll be able to say, hang tight, we have services that we will be able to provide you. So that's the first time that I'll be able to specifically say there are children's services amongst our community, and I'm happy to say that. We have no wrong door approach in Polk County, connecting people to the services they need. Access to children's crisis services available by calling the resource and the referral line at 515-288-0788, by visiting the Mental Health Urgent Care Center at 1250 East 9th Street in Des Moines, contacting the Mental Health Crisis Line by calling 211 extension 8, or if in danger or hurting yourself, you need to call 911 to access the mobile crisis unit. To help people better understand these services, Polk County Health Services has created an online toolkit, social media materials, and pre-recorded webinar that explains these services in greater detail. This information can be found on the Polk County Health Services website, pchsi.org. The Polk County Regional Governing Board is committed to continuing our partnership and establish an integrated regional array of mental health and disability services for children, adults, and families. We welcome your continued partnership as we take these next steps together. Now I think Liz has some closing remarks, and then we'll take questions. I get rid of all my paperwork.
Thank you, Angela. And thank you to Nancy and Sherry and Steve for being here today, and all of you for your hard work in making this day possible. This is the first step in a journey. We're probably not going to get it all perfectly right at 12:01 July 1st, but we are committed to working together to ensure that these services and other services in our community are accessible and available and effective. So I just want to reiterate that the resource material toolkit is available at our website, pchsia.org, and folks can reach help immediately if you need it. 211 extension 8 is the first place to go in the suicide prevention and mental health crisis line, and we look forward to working together as a community for success for everybody. I do welcome any questions for anybody here that anybody might have.